Trauma therapy. Trauma treatment helps individuals work through the traumatizing events that occurred, as well as their lasting experiences with the trauma that can occur after these events. Trauma therapy is focused on helping people who have had a past experience with trauma, or who have been diagnosed with a traumatic stress disorder, PTSD, to cope with the experience of trauma. Here's an overview of the various types of evidence-based therapies commonly used with individuals experiencing trauma. Psychodynamic trauma therapy is focused on various factors that can influence or contribute to the client's post-traumatic stress symptoms, such as experiences and coping mechanisms. Because it is focused on trauma in CBT, this type of therapy is conducted with greater sensitivity toward post-traumatic stress disorder and emotional disorders that can arise as a result of violence or bereavement. If a person experiencing trauma is a child or young adult, the trauma therapist might consider cognitive behavioral therapies with a trauma focus, TFCBT. Trauma-focused therapy is a type of mental health treatment adopted by trauma-informed therapists to help the individual who has been affected cope with his or her trauma. The primary goal of trauma-informed expressive arts therapies is to explore the ways that mind and body respond to traumatic events, to acknowledge symptoms as adaptive coping strategies, to prioritize cultural sensitivity, and to empower survivors of trauma to thrive in everyday life. In psychotherapy, mental health professionals will guide the patient while talking through his or her problems, memories, and thoughts about trauma in order to assist in a wide variety of mental illnesses and emotional difficulties. Referred to as talk therapy, psychotherapy gives the patient a chance to talk about his or her trauma and to work on a process to heal. Group therapy encourages survivors of similar traumatic events to share their experiences and reactions in a comfortable, non-judgmental environment. Therapy can help dispel faulty beliefs, support the development of new perspectives on traumatic events, and decrease the intensity of trauma-related emotions like shame and guilt, says Kelly Workman. Similar to CBT, cognitive processing therapy helps teach patients new, more positive ways of dealing with their trauma-related beliefs and emotions. During CPT, the therapist helps a client work through his or her beliefs about why a trauma occurred, how the trauma contributed to those beliefs, continues Dr. Golovsky. Eye movement desensitization and reprocessing, EMDR, therapies allow patients to focus on their trauma as they are visually stimulated. EMDR combines exposure therapy with a series of guided eye movements to help you process your traumatic memories and alter your reaction to them. Prolonged exposure therapy uses repeated, detailed imagery of the trauma, or gradual exposure to the symptoms triggered by it, in a safe, controlled manner, to help the individual confront and take control over fears and distress, and learn how to cope.